Hello, and welcome to Wound Care University's new Top 5 Countdown series, where me, Chelsea Thompson, is going to go through a weekly Top 5 countdown with you on some hot wound care topics. Let's get into it. If you have been working in wound care for a while, you are familiar with number one on our countdown, the unspoken language of wounds. If you've been doing this for a while, you can look at a wound and you kind of already know what's going on. So the wound is telling us a story. The drainage, the color, and oh boy, sometimes the odor. It's like a sixth sense, I feel like, that we develop over time where you can tell that something is definitely wrong. You can tell a lot by looking at the wound, the peri-wound, the skin condition. These are subtle changes that sometimes other people can miss, but if you've been doing this for a while, you have that little sense developed and you know exactly what is wrong. And like I said, sometimes even off the bat, what's wrong. If you take off a dressing, it is bright green. It smells like a sweet grape jelly. You already know what it is. I said it without even saying it. It's Pseudomonas. So that's definitely something that only we know. It's a special skill. Moving on to number two in our countdown, documentation is an art form. Now, sometimes if you go into a wound care nurse's notes, it really might look over the top, but oh my gosh, every little detail matters here, especially when it comes down to our staging, measurements. Is there a tunnel? Is there fistula? Do we have undermining? How much drainage is there? Documenting the quality of the peri-wound. Every single detail matters. You want to, of course, even document the quality of the tissue, the percentages of the tissue that you're seeing. These are all super important. This helps to protect the patients and clinicians, of course, but we need to capture the full story. If you are working with other team members, particularly this comes into play if I were to see a patient this week and you see them next week. If I don't paint an accurate story of what the wound looks like, feels like, smells like, you don't know exactly what was going on, and your documentation might not track exactly what's going on either if you're not getting a clear picture of their progress. So it helps us to figure out, is this wound worsening? Is it improving? If I documented inaccurately how much exudate there was on my week, you come in after me, you have no idea if it's worsened or improved. Very, very important to have that artful documentation. Here we are on number three, offloading. And boy, is it a battle sometimes. We know that convincing our patients to actually stay off their wound is a fight. And we have to get really creative with pillows, boots, anything, because when it comes to healing pressure wounds, pressure injuries, of course, that pressure relief is really everything. We have to get really creative with our positioning tricks. Those are just kind of tools of the trade that we get really familiar with. And we can, of course, teach those to our patients and their families. I know sometimes it does get down to issues of like your patient's independence and their comforts, but we do need to, of course, put on our education caps and help to educate our patients on the importance of offloading for pressure so that they can get on the road to healing. Now, number four, I think is pretty unique to wound care nursing, and that's odors. They don't scare us too much, and we know that wound odor management is definitely part of the science of wound care. And the odor, like we mentioned earlier, can actually tell us kind of what's going on with the wound, if the odor is worsening, if the odor's gotten better, if the odor's gotten different. That is part of how we can identify our wounds and document. But part of that is poker face. We of course want to stay professional and keep our patients comfortable. They likely do know that this odor does not smell wonderful. So we of course have to stay professional and let them know that we are unbothered, but we are trying to get to the bottom of that for them. So you got to deal with it like a pro, but boy, sometimes you smell that wound before you even get into the room. But that's all part of the job, and boy, do we love it all. We are on number five, the final part of our countdown, and we're getting deep. We're going to talk about the emotional weight of the job. At the end of the day, it's not just about the wounds for us. It's about our patients who are people, and we are actively working to not dehumanize them. We are very aware of their pain and their fear and their healing. Or if this is end of life care that we're doing, this, it really sticks with us. We have to balance actively empathy with a deep resilience. And a lot of the things that we experience and we see just, never leaves the bedside. But that always stays with us mentally. So it's very important to pay attention to your mental health, take care of you, while also making sure that you're advocating for patients who might also be really depressed because they do have a painful wound that is frustrating and has odor and they have lost hope. So it is really important to keep that as a part of just how we do our jobs, is maintaining and balancing the emotional weight in ourselves while also trying to unburden our patients at the same time.